It's 11 p.m., and you're doing what you do every single night before bed. You're standing in the kitchen, Heartworm chewable in hand, about to hand it to your dog. He takes it, swallows it in about 2 seconds, and you go to bed feeling like a responsible pet owner. But here's the question almost nobody asks. Does swallowing that pill actually mean it worked? What if the one habit standing between your dog and a completely preventable, potentially fatal disease isn't the pill itself? It's something that takes 30 extra seconds, and almost no one does it. Hi everyone, I'm Dr. Scott Reynolds, your neighborhood veterinarian, and I want to talk about heartworm prevention today, because it is one of the most common and most heartbreaking gaps I see in otherwise excellent pet care. Owners who are doing almost everything right, and still ending up with a heartworm-positive dog. In the next few minutes, we're going to walk through exactly how heartworm disease actually establishes itself in your dog's body. A simple way to understand what your prevention is really doing month to month. The single most common mistake that quietly cancels out months of protection, the 30-second habit that closes that gap completely, and the specific red flags that mean it's time to stop guessing and get your dog tested. So if you want your prevention routine to actually work the way you think it's working, go ahead and subscribe, because this is exactly the kind of gap we close every week on this channel. Let's start with what's actually happening biologically, because heartworm prevention is one of the most misunderstood routines in all of pet care. Heartworm disease doesn't come from a worm laying eggs inside your dog directly. It starts with a mosquito bite. When an infected mosquito bites your dog, it deposits microscopic larvae under the skin, and over the following weeks, those larvae migrate through tissue and eventually mature into adult worms that live in the pulmonary arteries and the heart itself, where they can grow up to 12 inches long and cause serious, sometimes irreversible damage to the heart and lungs. Here's the part that surprises most owners. The monthly chewable you give your dog isn't actually preventing infection in the way people assume. It's not blocking the mosquito bite, and it's not stopping larvae from entering your dog's body at all. What it's doing is retroactively killing any larvae that entered during roughly the previous 30 days, before they have a chance to mature into damaging adult worms. Think of it less like a shield and more like a monthly reset button. It's mopping up the last month's exposure, not preventing next month's. That distinction matters enormously, because it means timing consistency isn't a minor detail. It's the entire mechanism. So here's a simple way to actually assess your own routine at home. No special tools needed. Pull up your phone's calendar or your pill reminder app right now and look at the actual dates you gave the last 6 doses. Not what you remember, the actual logged dates. Most owners assume they're basically on time, but when they actually check, they find gaps of 5, 7, sometimes 10 days between doses that they never noticed because the packaging just says once a month, not a specific day. And here's a myth worth correcting directly. Giving the dose late once should be fine, because it's just heartworm prevention, not a real medication. That thinking is exactly backwards. Because remember, this medication works retroactively. A delayed dose means there's a longer window where larvae from a recent mosquito bite have had extra time to develop past the stage where the medication can reliably eliminate them. Here's the mistake I see constantly, and it's the real reason so many consistent owners still end up with a heartworm-positive dog at their annual test. Owners give the dose on a rough monthly basis. First week of the month, whenever they remember, whenever the bottle happens to be sitting on the counter, instead of on the same calendar date every single time. This seems harmless, but heartworm larvae have a developmental timeline inside the dog, and most monthly preventives are formulated with a safety margin that assumes doses are spaced no more than about 30 to 45 days apart at the absolute outside. When dosing drifts from, say, the 3rd of one month to the 15th of the next, that gap can stretch past 45 or even 50 days without the owner realizing it, because they're thinking in terms of, did I give this month's dose, not counting actual days since the last one. Over a year, that drift compounds, and you end up with several windows where a mosquito bite could result in larvae maturing just enough to survive the next dose. The real-world consequence isn't dramatic or immediate. It's a dog who tests heartworm positive at their annual vet visit, despite an owner who swears, honestly, that they never missed a dose. The safe alternative is remarkably simple. And it's the 30-second habit in the title. Pick one fixed calendar date, the same numbered day every month, and set a recurring phone alarm or calendar reminder for that exact date, not a vague monthly reminder. When that alarm goes off, you don't just give the dose, you also do one 30-second habit. Open your phone's reminder app right then and log the date you actually gave it, even if it's a simple one-word note. This does 2 things mechanically. First, it keeps your actual dosing interval locked to a consistent 28 to 31-day window instead of drifting, which keeps you safely inside the medication's designed protection margin. Second, it creates a real record you can bring to your vet, so if a gap ever does happen, you and your vet know exactly how long it was and can make an informed decision about testing, rather than guessing based on memory months later. Let's talk tiers, because the right approach depends on where you're starting from. If you're just beginning heartworm prevention with a puppy or a newly adopted dog, Tier 1 is simple. Start the fixed date system from day 1, and know that most heartworm preventives can typically be started as early as 6 to 8 weeks of age, though your vet needs to confirm the exact product and timing for your dog's weight and age. If you're an owner who's been giving prevention consistently but on a rough monthly basis rather than a fixed date, Tier 2 is the correction phase. Talk to your vet about your dog's actual annual heartworm test history, and going forward, adopt the fixed date alarm system starting today. Because consistency going forward is what actually matters most. If you've had one or more gaps of over 45 days in the past year, Tier 3 applies. And this is important. Don't just resume dosing as if nothing happened. A safety caveat here that matters. After any prevention gap longer than about 6 to 8 weeks, your vet may recommend a heartworm antigen test before restarting the medication. Because giving certain heartworm preventives to a dog that already has a significant adult worm burden can occasionally trigger a serious reaction. So testing first is the responsible move, not an overreaction. If your dog has already tested positive in the past and completed treatment, Tier 4 is lifelong strict adherence to the fixed date system, combined with your vet's recommended testing schedule, typically annual, because previously infected dogs and dogs in high mosquito density regions benefit from especially tight consistency. Here's my favorite trick, and it's genuinely one I recommend to every single client. Not just because it's clever, but because it actually solves the real problem we just talked about. Instead of relying on your memory or a generic phone reminder, use a 7-day pill organizer, the same kind people use for their own vitamins. But repurpose it specifically for heartworm dosing by placing that month's chewable in the slot corresponding to your fixed dosing date. So the empty compartment itself becomes a visual, physical confirmation that the dose was given, sitting right on your counter where you'll see it daily. It sounds almost too simple, but the mechanism is solid. It converts an abstract date you have to remember into a physical object you can visually verify at a glance, which is exactly the kind of low-effort system that actually survives busy weeks, travel, and the general chaos of daily life better than memory alone. Now, here's the part of this video that matters more than any reminder system. There's a clear line where tracking your own dosing stops being enough, and professional veterinary involvement becomes non-negotiable. If your dog has had any gap in heartworm prevention longer than about 8 weeks, that's a same-visit conversation with your vet before restarting, not something to handle on your own, because only a blood antigen test can tell you whether adult worms are already present. If you notice a persistent soft cough that doesn't resolve within a few days, along with reduced energy on walks or reluctance to exercise, those are classic early signs of heartworm-related lung and heart strain that needs same-week evaluation. If your dog shows labored breathing, a swollen abdomen, or sudden collapse or extreme weakness, especially after any exertion, that's an emergency requiring immediate care, because those signs can indicate advanced heartworm disease affecting heart function directly, something that requires imaging and blood work only available in a clinical setting. And if you're ever unsure whether a dosing gap was significant enough to matter, the honest answer is to call your vet and ask rather than guess. Because determining safe next steps after a lapse depends on factors like your region's mosquito season and your dog's individual risk that really do need a professional assessment. So here's how this all comes together. Heartworm prevention isn't really about remembering to buy the chewable every month. It's about turning a vague monthly habit into a precise, trackable routine. Understanding that the medication works backward in time rather than forward. Catching the silent drift that turns monthly into every 45 to 50 days. And knowing exactly when a gap needs professional testing rather than a shrug. None of this is about being a perfect pet owner. Building a system that removes reliance on memory and knowing when to loop your vet in is what responsible, loving pet ownership actually looks like. I want to hear from you in the comments. When you actually go check your dosing dates right now, is the gap between doses closer to 30 days, or does it stretch longer than you expected? I read every single comment, and hearing real numbers from real routines helps other owners realize just how common this quiet drift actually is. If this helped you rethink your own routine, hit like and subscribe so we can keep reaching worried pet owners who think they're doing everything right and just need one small system to close the gap. I'm Dr. Scott Reynolds. Stay safe, and I'll see you in the next one.